you're beautiful, no matter what they say. Words can't bring me down.
So today we're going to talk about body dysmorphic disorder, which is also related to obsessive compulsive disorder. So body dysmorphic disorder, or BDD, is known as a preoccupation with some physical defect in appearance by someone who actually looks relatively normal. And this defect can't really be seen by anyone else, so you can think of it as imagined ugliness. And for this, I made a little drawing to help. So we're going to talk about Jim Bob as an example. So Jim Bob goes out, and he is so caught up with the way his nose looks, and he thinks that when he talks to people, all they look at is his nose. So whether people talk to him or not, it all relates back to his nose. If they talk to him, all they see is his nose, and if they don't talk to him, then it must be because his nose is so ugly that people don't want to talk to them. So, when Jim Bob goes out, this would be how Jim Bob sees himself. And then this would be how we actually see Jim Bob. He thinks he has a huge tomato nose when he actually doesn't. He actually looks relatively normal to us. So, in order for an individual to be diagnosed with body dysmorphic disorder, they first have to meet a certain set of criteria. The first thing being the preoccupation with the defect that I described earlier. And the second thing is throughout the process, somewhere the individual is going to complete some kind of repetitive behavior or ritual, such as being in the mirror for an excessive amount of time, or taking a lot of time to groom yourself throughout the day, or maybe even a lot of skin picking. And then they'll either do that or possibly even some mental act such as comparing their appearance to the appearance of others. And then the third thing is going to be that the preoccupation has to cause the individual some kind of clinically significant distress or impairment, either socially, occupationally, or some other important area like that. And then the fourth thing is that the preoccupation cannot be better described by the criteria for an eating disorder. In addition to the other criteria, during the diagnosis, the patient's insights and beliefs are also specified. The first is good or fair insight. This is when the individual realizes that their body dysmorphic beliefs are definitely not true, or may not exactly be true. The second is poor insight. This is when they think that those beliefs are probably true. The third is absent insight or delusional beliefs. This is when they are absolutely convinced that those thoughts are true. And then the fourth is muscle dysmorphia. This is when the individual is obsessed with the idea that their body build is either too small or insufficiently muscular. And then this criteria can be used even if the preoccupation affects another part of the body. Okay, so some important things to know about body dysmorphic disorder is that the prevalence is roughly 1 to 2% of people in a lifetime. Also, the onset is early adolescence through the 20s, and once the disorder onsets, it takes a chronic or lifetime course. Also, as one might suspect, it affects more females than males, with the ratio being 2 to 1. However, it seems that a 1 to 1 ratio is present in therapy. Okay, so now that we've gone through kind of the basics of body dysmorphic disorder, I'd really like to get into some cultural examples which I think are really neat and fascinating. First, I'll point out some famous celebrities who have been affected by body dysmorphic disorder. Brittany Snow, Rob Pattinson, Hayden Panettiere, Sarah Michelle Gellar, and Uma Thurman are just a few of the notable ones that I found. And if you've ever seen any of these people, they're absolutely beautiful, and you would never suspect that any of them would be affected by such a disorder. However, such a disorder seems to be a debilitating factor in their lives. One noted was Hayden Panettiere, and she found it impossible to work or get out because she was so self-conscious and insecure about her body because an article had related her to cellulite, and ever since she saw that, she couldn't get past it and couldn't find a way to get around it. Another example I really like to point out, I don't know if anyone's seen it, but there's a show on E! It's called Botched. And it's two surgeons that do these cosmetic surgeries for people that are so extreme. And if you watch it, you'll just understand what I mean. Some examples of people on there with body dysmorphic disorder are Renee, She had flippable butt implants. She was so insecure about her butt that she had it done numerous times, and it ended up being very, very dangerous to her health. And also, my favorite, the human Ken and Barbie dolls. Those people have had hundreds of these surgeries just because they are so obsessed with their bodies and have so many insecurities that they think all these surgeries will fix it or make it better. And one thing I'd like to point out is that a lot of these people will actually go to plastic surgeons and seek out these surgical solutions rather than kind of therapy or things like that. And it actually shows that these surgical procedures make it worse and make the effects of this disorder even worse rather than improving them. At this point, very little is known about the etiology of body dysmorphic disorder. There is no meaningful information regarding possible biological or psychological factors or vulnerabilities, and there's almost no information as to whether or not it runs in families. As of right now, one of the best ideas regarding etiology of this disorder comes from the psychoanalytic point of view, and that centers mostly on the defense mechanism of displacement. And that basically says that there's an underlying unconscious conflict within the person that is so intense and anxiety-provoking that they don't admit it into consciousness. Rather, they'll take it and displace it onto a body part. At this point, the little evidence that we do have regarding etiology comes from a pattern of comorbidity with OCD, which exists in about 10% of the people who have body dysmorphic disorder. So this suggests a possible similarity in etiology between the two. At this point, there only seem to be 2 treatments which are effective in treating this disorder, which are, interestingly enough, the same ones found to be effective in treating OCD. The first of which involves drugs that block the reuptake of serotonin, such as clomipramine, otherwise known as anafranil, and fluvoxamine, known commonly as Luvox. The second type of treatment is exposure and response prevention, which is a type of cognitive behavioral therapy. It's shown to be effective in treating OCD as well as this disorder, and it tends to produce better and longer lasting results when compared to taking the medication alone. However, its downfall comes in that it is not as readily available as medication. Body dysmorphic disorder is a debilitating condition in which individuals suffer from reacting to deformities that others cannot perceive. And although at this point not much is known regarding the causes and treatments of this disorder, we have hope that time and research will yield solutions. And until then, I would like to leave you with a quote from Hayden Panettiere: "Beauty is an opinion, not a fact."